Hello, good afternoon, and welcome to the second seminar of the HEU-EFS project. You are too many, so I cannot double check how many of you already know the project and if there is anybody who doesn't know what we are talking about. But just for the benefit of everybody, let's remind us all of the global objective of this European Union funded project, HEU-EFS. EFS stands for Early Feasibility Studies, and the overall objective of this big consortium is that of designing and developing a European program for early feasibility studies in the area of medical devices, including also digital medical devices. Okay, so the agenda of this second webinar, as you can see, is quite packed. I have the honor of introducing the agenda and the colleagues who will come after me, starting with Alexandra Paulson from the Norwegian Institute of Public Health, and I will leave to Alexandra to introduce the next speakers after her. So if we go to the second slide with the objectives of this second webinar, well, I mean, as you can see, our major goals of this afternoon are these are three objectives. So first of all, we would like to recap on what we have proposed in terms of a methodological framework, and more specifically, we would like to clarify in more details what are the eligibility criteria, what is the process, what are the templates that are needed to be considered in order to submit and carry on the pilot projects of the HEU-EFS. The second objective is that of describing again in detail and discussing the application of the pilot projects. As you may know, because we said this at the end of the first webinar, we are going to carry on a maximum number of 10 pilot projects, and we will also go ahead with the implementation process. I don't see any longer the slides on my screen. I don't know whether it's my fault or if there is any issue. And but in the meantime, I can go ahead. And the third objective is that of having an interaction with you all. You are basically experts, and you know very well what we are talking about, which means that we are here very happy to listen to you, to gather your questions, to gather your opinions, and to answer to all your doubts or questions. Let's go ahead with the next slide. Okay, so first of all, if you didn't attend the first webinar, or you did attend but you don't really remember what was basically said during that webinar, don't panic, because everything has been recorded and has been uploaded in our website, HEU-EFS.eu. Also, this second webinar will be recorded, and everything will be uploaded in our website. So I mean, don't be afraid of losing anything. You can even don't take any notes, because everything will be there. And finally, I believe there is the final slide, if I'm not mistaken. And okay, and if not, I mean, if this was the final slide, then in my position as one of the leaders of this project, together with Giuditta and all other colleagues, welcome again to the second webinar, and I will leave now the floor to Alexandra Paulson for our second session of the webinar. Okay, so I did remember that there was the final slide, and indeed, I mean, I joined the conversation. because I mean, as I said, we really would like to get an interaction with you all. We do advise you to raise your hand when there will be, you know, the space and the time for the interactive part. So please do raise your hand, and we will be more than happy to join the conversation and answer to any of your questions. And now I think it's, you know, really, you know, the time for Alexandra to get the stage. Thank you, thank you.
Thank you so much, Rosanna, and thank you for the kind introduction. So I'm going to be giving you a little bit of a recap and a bit of background to how we develop this process. So the methodology of the framework for early feasibility studies that we're proposing. So next slide, please. So this project is now halfway. It's an EU-funded project, and over the past 2 years, we've been collecting a lot of information around early feasibility studies from both Europe and outside Europe. And all of this we've been putting together to develop this framework. We've also been developing eligibility criteria, looking at the technologies where these type of studies are most relevant, whether it should be targeted at specific patient conditions, which we decided it shouldn't be, the level of preclinical evidence that is needed in order to start such a study, and the experience and competence of trialists and clinical sites that are needed for these studies. We've also then developed templates and checklists, which I'm going to talk about in a bit more detail, and the process I'm going to show you in much more detail. And in order to understand whether this is all working, we have also developed key performance indicators in order to update and revise the procedure after the pilots have been run. And so here we are proposing the pilot participation from you. And so this is the goal of all of this together, that we're supposed to develop, or we are developing, a framework for early feasibility studies in the European Union. Next slide, please. So from the eligibility criteria, from the perspective of the technology, we're focusing on high-risk medical devices, the class 3 and 2B, where a clinical investigation will be required as part of the conformity assessment. And so we're looking at breakthrough devices, devices where there's an unmet patient need, where the anatomical understanding, where the device will go in, is not fully understood, and so therefore the device will be placed early in the development to see if this has been achieved, or whether there is a new expanded intended use for the indications. And so, as you see, you know, the devices, the risk classes of medical devices in Europe, and we're focusing on the 2 highest classes here. Next slide, please. So from the preclinical evidence perspective, of course, GSPR is the foundation, and so preclinical testing is expected to be as far as possible from this perspective. But of course, in these early feasibility studies, the design is probably not finalized, and part of the reason for the feasibility study is to finalize the design, and therefore the design is in an iterative process. So some of the GSPR will be answered through the early feasibility study. There also should be justifications to show why the GSPR isn't as compliant as it would be in other clinical investigations. And it's also possible to have concurrent testing with the study, as long as it doesn't cause greater risk to the patients who will then be enrolled. And we also fully support leveraging data from similar devices. So in areas, for example, packaging or production, which will not have been established at this stage in development, this is what we're expecting you to use here. Next slide, please. And then from the clinical sites and clinical expertise perspective, we worked on this together with hospitals, patients, a patient advisory group specifically, and academia, competent authorities. And so one of the areas that we focused on here is that the regulatory competence needs to be increased for all parties involved, so both sponsors, competent authorities, ethics committees, and principals investigators, so everybody is on the same page. The personnel involved in conducting the early feasibility studies should be qualified in good clinical practice, and also any national qualifications that are needed. It's important that the clinical site has the capacity and equipment to offer adequate emergency care and support systems for early feasibility studies, and the clinical staff are experienced within the therapeutic area. And from the patient advisory group in the project, independence and transparency was lifted as one of the areas of importance. And of course, in these early studies, the clinicians are often involved in developing these very innovative devices, so they may not have total independence, but the relationship should be transparent. And also dedicated units or personnel for conducting the regulatory submissions and contracts was one of the areas that we saw was important to have in place. Next slide, please. So from the process that we're proposing enhanced early dialogue. We're proposing an accelerated process, a reduction in time by approximately 30%. We've streamlined the templates, checklists, and performance indicators specifically towards early feasibility studies. And we identified that, inspired by the coordinated assessment, if possible, a parallel evaluation by the competent authority and the ethics committee is a big advantage. And this process will then lead to that it's more timely, more efficient, and more collaborative from all the stakeholders involved. Next slide, please. So to delve into detail a bit in the process, we have split it up into a pre-submission and a submission and review process. And here you have the contact point early on to allow for planning and research allocation at the competent authority, and early dialogue to allow for sponsors, competent authorities, and where appropriate, ethics committees, the experts that the competent authorities might bring in, principal investigators for the site, to have a discussion about the feasibility study before the submission so that any questions can be answered. And then we move into the submission phase, where there's the validation of the application for completeness, and we've looked at the competent authority time, the request for more information, and that this should be reduced slightly from both sides. And then the review process as well, where we suggest that, for example, clock stop could be used, or a rolling review, in order for the process to go more quickly and more smoothly. And the target is to reduce the overall time by 30% compared to the normal times proposed in MDR. Next slide, please. So to delve into a bit more detail in the pre-submission phase, so the contact point is to alert the NCAs of an incoming application. And this can be 6 months ahead of time, but to tell them that you're planning to submit in the next 6 months and maybe give them a very more detailed time frame. It allows you to propose the device technology, the key principles of it, and allows you to outline from the sponsor perspective qualifications which would allow you the accelerated review. Then once this has been confirmed, and all we're expecting here from the competent authority is an email to say that they've received your contact point, that's all that's expected here. And it allows the competent authority to maybe bring in experts that they need for some very innovative devices in specific areas. So the next stage is early dialogue. And here we very much suggest that all sponsors engage in early dialogue. From the mapping that we've done with the competent authorities, there are this is an availability at most competent authorities and gives you the opportunity as sponsors to ask detailed questions about the application, understand what is needed, what is not needed, discuss patient populations, details of the clinical investigation, and also allows you to show the background that you are up to speed with your preclinical testing, that you have all your ducks in a row ready for submitting for a clinical investigation. Next slide, please. So this is then the submission phase, where there's the validation. And on the left side here, you can see the traditional process through MDR. And on the right-hand side here, you can see what we're proposing. So where MDR has 10 to 55 days for the validation phase, we're proposing a reduction down to 39 days for the accelerated process. And you see when we delve into it, the NCA has a reduction in 3 days. And the higher reduction is for the sponsor, because the sponsor should be ready to respond and to appropriately answer any questions that come about the submission. And then we've kept the final validation timeframe the same. And then for the review phase, as you can see here, MDR allows you 45 to 65. So we've reduced this a little bit to 30 to 45 days. And the idea here is by using a rolling review or interactive question approach, stop clock, and approval with conditions, that time can be reduced. But also, again, here the sponsor has to be very proactive and answer any issues in a timely fashion. And of course, here we say that the competent authority can utilize the remaining time on the clock as they wish. Next slide, please. So just to show a little bit more detail here, if there are any deficiencies during the accelerated process and the sponsor is unable to respond within the timeframes that we have proposed, then of course from the competent authority's perspective, they can't manage to do this in an accelerated process, and then it would revert to the MDR process. And so this is just to make you understand that everybody has to lean forward here and work in a appropriate manner in order to achieve this together. Next slide, please. So to help you on the way, we have developed a self-evaluation checklist, and this is for internal use to help you understand if you have everything ready for an early feasibility study submission. We've developed a clinical investigation plan tailored for EFS based on the MDCG guidance. So there's a template and there's a checklist. And then also informed consent template based on MDR with a checklist so that you can verify internally that everything is as it should be. And a master clinical trial agreement checklist to make sure all the contractual elements are in place, and an insurance agreement guidance to understand whether all the minimal essential requirements are in place. So next slide, please. So in order for us to gauge how this is going in the pilots, we need data from you, of course. And so we've split this into 4 key points. So we have a pre-submission process questionnaire. So once you've submitted, we would like you to answer this. Then after the about the submission phase, and then after the application is submitted. So these are the first 2 phases. And then there's the 3rd phase after the authorization, and the 4th phase, which is after completion of the pilot, so that we understand if the proposed process that we have has been useful to you, whether the competent authority has managed to accommodate this, how the ethics committee has been, these type of details. And I think then I am opening to questions. So if I could have the next slide, please. So if you have any questions, just raise your hand and we have a few minutes to yes, answer them. Heiko, please come in. Just unmute yourself.
Oh, yes. So first of all, many thanks for your work here and all this information. One very interesting slide was slide 15 on the validation and review in detail, where you propose shortened timelines compared to MDR. And my question is, have you been in contact already as well with competent authorities and what their reaction was on these proposed timelines?
Yes, we have. And I have to honestly say we wouldn't dare do this if we hadn't done this. We've presented to the subgroup for clinical investigation and evaluation and performance studies. So we've presented it there. We've also discussed directly with specific competent authorities, but also from your perspective as a potential sponsor, if you were chosen to be a pilot study, you would identify a competent authority. We would also engage directly with them to make them, if they're not already familiar with the process, we would go into detail with them on the process as well. And so, as you saw, we're being quite minimalistic on their side, but we're hoping that by having this pre-submission phase, whereby they know you're coming, they know a little bit about your device, and you've already had an early dialogue meeting with them, then that they are also very much prepared for your submission.
Yeah, so this early dialogue will make the difference.
Well, we also think that the contact point is a good thing because, of course, the competent authorities don't have a booking system. And so the contact point will allow them to know that you're coming, and you can even identify, if you know exactly when you're going to submit, then you can identify that to them, and that'll help them a lot in their planning. So a lot of this is, as I said, getting all the ducks in a row to make it a smooth process.
Thanks so much.
Thank you. So somebody who has the time can check if we have time for another question or whether we have to move on.
Sasha, maybe we can move on, and in case there are questions, there will be the possibility to answer them later on.
I have maybe one other question, if I
Please.
may. This is on slide 17 on the templates. And what is important, I think, in an EFS is exactly the GSPRs and what is included and what is not, especially testing of the devices. Of course, we know EFS, we have limited testing available. And this needs to be somehow implemented into the GSPR and, of course, to be accepted by the competent authorities. Do you have as well a checklist on GSPRs? What should be in and what not? Because that's always the question we receive from our business units coming with these protocols.
Yeah, we would love to have developed that already. It's something that we'd like to do in the future, but we didn't manage to do at this stage. Okay. But we fully support this idea.
Thank you.
Thank you. Then I will leave the floor to, is it Judita who's taking over?
Yes, but Manon will come first. So Manon, please.
Yes, thank you. Yes, I will start indeed. Good afternoon, everyone. I am Manon Vilkens. I'm representing Medtronic in this consortium. Today I will talk to you more about the launch that we recently did, the public launch that we recently did for use cases, and then Judita will take over and talk about the pathway towards the submission, the key pathway towards the submission of an application to the competent authorities of a pilot use case. So yes, we have launched the public pilots call. The consortium, of course, is not only focusing on the development of a regulatory pathway for early feasibility studies, very important is also to test this framework and validate whether it is really an additional value in this regulatory landscape. So that's why we are using pilot use cases to validate the framework. So yes, we will use these recommendations that we will receive from this testing to improve the methodology. So that is why we are really happy to have so many people interested in our efforts here. So we do have also some pilot use cases within the consortium, but also we are very happy to be able to offer the opportunity and to increase the number of pilots externally as well. This is not only to increase the number, but also to expand the patient conditions, to obtain valuable feedback from entities that were not yet involved in preparation of the framework, and also to create more awareness of these efforts that we are undertaking. Next slide, please. Thank you. So as a sponsor interested in contributing with a pilot use case in this consortium, we would like to also explain, why this is of additional value for you to participate. So as a sponsor, you will have the opportunity to test the streamlined processes and the templates that we have developed for submissions to the competent authorities of early feasibility studies. As a participant, you will also benefit from a unique learning experience and engagement with our consortium experts. It is also an opportunity for you to contribute and really shape the development of this future HEU-EFS program that we are currently proposing. Next slide, please. So when considering submitting a use case in the consortium, you will also need to take into account certain criteria. So these eligibility criteria, also described by Sasha already, the objective of in scope are the high-risk devices only, so class 3 and class 2B devices, which are where a clinical investigation is required as part of the conformity assessment. So these can be breakthrough devices when early clinical data are needed. This can be a study to obtain more understanding of the safety and performance of the device when used in humans, or when a new or an expanded intended use or indication of the device is being explored. In addition to that, when you consider to submit a use case, it is important that at least one of the countries, at least a submission will take in one of the countries within the European Union, so that we can really test the framework within the European Union, and that you are planning to submit your application by November 2026 latest. So, and with that, I hand over to Judita.
Thank you, Manon. I will now drive you in detail into the 6 steps of the pilot preparation. So first of all, there will be a submission of an expression of interest, followed by an information call with us, with the screening committee members. In case of green light, you will submit an additional online form. We will prioritize the applications, and to those who have been prioritized, we will ask to complete an open access online training, followed finally by the application to the competent authority. The deadline for submitting the expressions of interest is March 31st. And the final application to the competent authority should be completed by the end of November 2026. We commit to be faster in our decisions, in our evaluations. We have the screening committee, and you will see the members shown in next slide. We have already booked our agendas two meetings every month, but we'll be happy to organize more frequent meetings in case we will receive a high number of applications. So next slide, please. Who are your point of contact? So first of all, you have an email dedicated that is pilot@heu-efs.eu, and this email is accessed by Bocconi University, and we reply to any messages that you send us through this email. We have identified 3 members of the screening committee. Myself, and I am acting as a chair of the screening committee as principal investigator of the project, Sasha Poulson, that you have already met, and Tom Melvin. So these are 3 members of the public consortium, 2 academic organizations and an HTA body. And these people that you see here in front of you are those who will have access to any information that you will submit to us. In this slide, you will find a link to access the terms of reference. Next slide, please. Okay, so everything starts with the submission of an expression of interest. There is an online form available on our website. We start the process by asking you some information just to understand whether you are fitting with our purpose and our timeline, because as you know, we have this project will last 4 years. We have started the 3rd year, and everything will end by September 2027. So we have to make sure that the pilots can help us testing the framework and suggest any possible improvement. Therefore, we need to make sure that you meet the eligibility criteria. The technology that you are developing is a class 3 or 2B and meets the eligibility criteria presented earlier on, that you are planning to submit to the competent authority by November next year. We would like to know whether you have already identified a competent authority, what is the therapeutic area. We will confirm that we have received your expression of interest, and the screening committee will assess the information that you provide and give you a feedback. And in case you are in scope, we will offer some dates to have an information call, so to have a meeting where we may discuss some additional information. We encourage you to submit the expression of interest as soon as you know that you have an interest and you want to let us know that you would like to be part of the pilot phase. We do not ask a specific level of completion of the preclinical tests. The only request, we want to make sure that you are ready for the submission by November next year. Next, please. During the information call, you will meet the 3 of us, myself, Sasha, and Tom, and we will have these 30 minutes to discuss live, to have some additional information that were not part of the initial expression of interest. We commit to meet no later than 2 weeks after the submission of the expression of interest. In case we realize that you are really fitting for the purpose, we will provide you positive feedback, and at that point you will be asked to fill out an online form. And please move to next slide. We have prepared an online form that asks some additional information on top of what has already been requested in the previous steps. We are not asking any technical documentation, so we are not going too much in details into your technology and into the study. We are not asking the protocol or the investigator's brochure or the informed consent form, so nothing of this has to be submitted. But here we want to assess the readiness. Have you already identified, for instance, the country? Have you already identified the clinical site, the ethics committee, just in case you are planning to submit the application in a country where the ethics committee is not randomly assigned? We meet periodically to evaluate the online forms that we receive. And please, if you go to next slide, we will prioritize. We are not waiting until the end of the process to prioritize the applications. As soon as we receive applications, we start considering them, and we will prioritize them, and we will provide a feedback on a rolling base, basically. What will we consider to prioritize the applications? Well, first of all, we want to know which parts of the process you are willing to test. Are you willing to test the early dialogue, the accelerated process? Are you willing to use our templates, or instead use checklists because you have already developed some internal templates? So we will ask you, how are you going to contribute to the pilot phase? Of course, we will do a final check regarding the compliance with our eligibility criteria and whether you are ready. We will not help you to fill out and prepare the documentation. We are not acting as a CRO, and this has to be very clear, but we are at your disposal in case you have any doubts. As I told you, we have already in our agendas 2 review cycle meetings per month, but we may decide to have more frequent meetings. Next slide, please. We are finalizing, and it will be shortly available on our website, a training which will be open access to all the stakeholders interested, not only to those who will attend and participate in the pilot phase, but we recommend that those who are willing to participate and contribute to a pilot, we recommend the completion of this training. You will find a number of short video recordings, some pills that facilitate your understanding of the different aspects and items of our process. Last, next slide, please. By November the 30th next year, you have to complete your application to a national competent authority. We are asking since the very beginning the name of the member state where you are planning to submit your application because we want to reach out. We are in touch with the competent authorities. We are interviewing them, we meet them regularly, but we want, as soon as we receive the confirmation that there is an interest for an application in a specific country, we are reaching out to the competent authority, and in case you have identified the ethics committee, we will reach out to the ethics committee to inform them that they will receive an application that is linked to our project, and it's a pilot that will help us finalizing the HEU-EFS methodology. it's important to say that any applicant will finance its own study. So the European Union and the HEU-EFS project are not contributing through public funds, and you are requested to pay for your own clinical investigation. By the way, right now we have a task force within the consortium who is conducting research on possible mechanisms that can facilitate the conduction of R&D in the European Union, and by the end of the project we will provide with some recommendations on how to facilitate the conduction of such studies, especially for SMEs. Next slide, please. Okay, we will ask you if you have been prioritized and you go for the application to help us collecting some feedback during the application, during the dialogue, during the conduction of the study in different moments, because our final aim is to collaborate and to receive important feedback that help us improving the proposed framework. This has already been said, we will prioritize a maximum of 10 public pilots, and remember that the applications will be handled on a first-come, first-served basis. You will find all the information on our website, and we will shortly make available also some frequently asked questions, so the questions that have been asked during the first webinar, together with the ones that we will receive today. You will find all the questions and the answers in a specific document on our website. Next slide, please. And I think this is all, and I'm happy to leave the floor to Fanny van der Loo.
Thank you, Judita and all, for the very clear overview. Very happy to open now the floor for any questions or answers. No, questions first, and then hopefully we will have the answers to the questions. So again, if you have any questions for us, we would kindly ask you to raise your hand and unmute yourself, and also to mention your name and affiliation, so that we can understand from which organization you are from today. So we have to respond to any of the questions, we have the members of the screening committee. So you will have just heard Alexandra and Judita, and we also have with us Tom Melvin today, who would also be very pleased to answer any questions. So just looking at the virtual audience to see if anyone dares to go first. And if not, then of course, we are also accepting any written questions. Yes, Heiko first.
Sorry, that's me again.
Yes, that's great.
Heiko Zerlich from Abbott Medical. You're talking about 10 slots. Maybe shy question. How many are still open? Still 10 or?
Yes.
Okay, thank you.
I can take this, maybe Fanny.
Yes,
so we have already received, we know that the expression of interest was accessed and revised by, well, roughly 30 of you. We have received, I think, 4 four expressions of interest, and we are reaching out to them. I can anticipate that in one case they were very much early because they anticipated the times they are not planning to submit the application in 2026. But we will reach out to everybody and give the opportunity also to those who are planning a submission later on. We have already conducted one first initial interview. So we had a meeting and, well, a couple of. So the slots are open, but we know for sure that there are a couple of good candidates.
Mhm.
What
Thank
I
you.
can say is that the online form still has to be filled out by all. So all 10 positions are open with a couple of competitors.
Thank you.
Thank you,
Thank you.
Judita. Then Irene had raised her hand. Irene, would you like to come in? No?
Can you hear me?
Yes. Yes, we can hear you now.
Okay.
Thank you.
Sorry about that. Some technical problems, and I missed the beginning part of the presentation. But I was just curious if you could tell us a little bit more about the eligibility criteria, and yeah, I suppose in terms of therapeutic areas, can be any. I don't know if there is any therapeutic area in particular that might be of interest. And apart from that, yeah, what would you say are the key eligibility criteria?
Thank you. Thank you, Irene. Excellent question. May I quickly ask you from which organization you are?
Oh, yes. I'm an independent consultant. I work across MedTech, IGEA Healthcare, and I do work with a couple of startups that I'm thinking could potentially be interested in this. So that's why I'm asking.
Thank you so much.
I
Thank you
don't
so
have
much.
my own startup.
Okay, that's very clear clarification. Maybe I can hand over to Sasha to respond to the question.
Yeah, thank you for your question, Irina. You may have missed it, but we're focusing on the high-risk devices, class 3 and 2B, where
Yeah, I've got that.
Okay.
Okay.
So, but we're not. We decided that we wouldn't focus on a therapeutic area. We think it's more important to understand that the process works than focusing in on any specific therapeutic area.
Mm-hmm. Okay. And I mean, other than the risk class, is there anything else that could be helpful to know at this stage?
Well, also they need to be submitting within the end of 2026.
Right. Okay. Okay. And other than that, it's open to everyone who wants to put themselves
Yes.
forward. Mm-hmm.
Exactly.
Okay. Thank you.
Thank you, Irene. Yes,
Maybe
Judita?
if I can complement, as Irene is interested in medical conditions, on our website, Irene, you can find one of our deliverables that is deliverable 1.3, where we collected some evidence regarding EFS conducted so far in the United States, in Europe, and other jurisdictions. And you will find some analyses that show that cardiovascular is by far the therapeutic area where the largest, the majority of EFS are conducted, but there are other areas that are relevant, for instance, diabetes, neurology. There is a growing importance of digital health technologies. So you will find some additional information with respect to view what happened up to now.
Okay, that's great. Thank you very much, Judita.
Thank you. Is there anyone else who would have a question to raise with Tom, with Judita, or with Sasha? Otherwise, of course, we are always available via email. You can reach us on various email addresses that we have also put in the slides. Yes, I see that Sylvie Morel has would like to come in.
Yes, I've got a very practical question. I would like to understand if those early feasibility studies can be conducted in several countries, EU members at the same time, or if then there is a need for one country to be targeted and that's it.
That's a great question. May I ask from which organization you are, Sylvie?
Boston Scientific.
Thank you. Tom, would you like to take that question, or Sasha? Yes, go ahead.
I can take it then. So we're totally open that you can submit to more than one competent authority. Due to the size of the study, we thought maybe it might not be so likely, but if you wish to do so, then we are open, and we're also open. We've been in touch with many competent authorities, and we'll continue to do that based on you identifying them for us as well.
And if I may, is there a list of competent authority that you're interacting with or that are happy to get on board with that pilot process, or that could be any EU competent authorities?
Any EU competent authority we will approach for you in advance of you submitting.
Okay, thank you.
Thank you for the question. Anyone else would like to come in? Okay, then I suggest that we close the Q&A part of the session. And here, just a reminder on different links where you can find more information about the project, about the call for expression specifically for the pilots, where you can really find all the information necessary to proceed with expressing your interest, and where you can also find all the information around the role of the screening committee. We also put here a link to the project deliverables, where you can find a recap of the different research and analysis that have led us to proposing the different process elements and checklists and templates, as well as our channel on LinkedIn, where you can stay up to date with any of the new news that we will be releasing as the project will continue to unfold. Please reach out to us also via email if you have any specific questions that you would like to discuss with the screening committee of the consortium. You can reach us at projects@heu-efs.eu, and we will make sure also in the recap email to put the email address again, so that does not get lost. So I'm very happy to hand back now to Judita and Rosanna for any of the closing remarks.
Thank you, Fanny. I wish to tell you that some of you have reached out before taking the decision of submitting an expression of interest, because they wanted to clarify some doubts. They wanted, for instance, to make sure about the confidentiality of information. And I apologize, I forgot to mention that the screening committee members will sign a non-disclosure agreement before the submission of the online form. So just in case you have any doubts or you want to discuss something with us before taking the decision to submit the expression of interest, please reach out and we will be happy to schedule a meeting with you to have an understanding, to answer to any of your questions. I would like to thank you very much for your attendance today. and look forward to receiving more and more expressions of interest and meet you together with the other members of the screening committee in these one-to-one meetings. So thank you very much. As we are approaching the end of the year, I would also like to wish you some Merry Christmas and wonderful and very relaxing holidays, and we will meet in the new year. So, Rosanna, I leave you the floor for the final goodbye to our participants.
Thank you, Giuditta, and thank you to everybody. But most importantly, thank you for all of you who have participated to this second webinar. As all my colleagues have said, we are really happy to be reached out by you for any kind of question or doubt or clarification. We really wanted to collaborate with you all. So also from my end, big thank you. And again, as Giuditta says, December is the month of holidays. So I really wish you all a very good break season. Ciao, ciao.